Hi everyone, I'm Dr. Kristi, and I am so excited to share with you this three-part video series on one of my favorite topics. It's one of the things that I specialize in my practice, and it's on perimenopause. So it's a three-part video series. So today's video is going to be on what is perimenopause, what specifically does that mean, and what are some of the signs and symptoms that are commonly experienced by women. The second video is going to be on testing. So testing women who are going through perimenopause. So that would be blood testing, salivary testing, urine testing, 24-hour urine testing, dried urine hormone testing, and other types of diagnostic criteria. The third video is going to be on treatment options for helping women going through perimenopause. So that could be naturopathic functional medicine treatments, looking at diet, lifestyle, looking at stress management, using botanical medicine products, nutritional supplement products, and then also, of course, prescription bioidentical hormones as well. So we'll talk all about that in video 3. So for today we're going to talk about what is perimenopause and what are some of the symptoms. So perimenopause, the word peri just means around, like the word perimeter. So perimenopause usually means that it's a transition phase for women. So it usually means that perimenopause starts and it may last for a number of just a few years. It might go on for 10 years. I would say for a lot of women, perimenopause usually starts around age 40. It could be early 40s. It could be late 30s. It could be as late as late 40s. I know a lot of female patients of mine, their last period is at 57 or 58 or 60, which is less common. So their perimenopausal symptoms might start in their early 50s. Most women, it starts in their early 40s, and it usually lasts a number of years. And some of them are subtle, but as you start approaching menopause, which menopause is actually when the period stops completely for a full 12 months and usually does not come back. The perimenopause is just the time leading up to that stopping of the periods completely. And it creates a lot of signs and symptoms, or a lot of symptoms that are frustrating, uncomfortable for a lot of women. And sometimes women just don't know what they're going through. They know their body feels different than it used to the previous decade, and definitely different from how they used to feel back in their 20s. But yeah, the body feels different, and it's because of hormone changes. So what usually happens is our ovaries, that are these tiny little almond-shaped organs that women have. Women are born with 2 ovaries, and we are born with a certain number of eggs at birth. And every menstrual cycle, there is an egg released, and if it's not fertilized, then that creates a menstrual period, a bleed. But what happens for perimenopause is the hormones produced from those ovaries are not produced in as high abundance as they used to. There's this cascade of communication between the hypothalamus, the pituitary gland, and the ovaries, and it's called the HPO axis, the hypothalamic pituitary ovarian axis. There's this communication that normally is in play every month for a woman that's having a menstrual period. And that tends to get a little bit off during that time. And it's usually the ovaries saying, we are starting to close for business. The ovaries are getting maybe a little bit older, a little more sluggish. And it's because the hormones, the ovaries are not designed to produce an infinite amount of hormones for the entire life. So fertility goes down, ovulation starts to become irregular. Ovulation is usually 2 weeks before a woman gets her menstrual period. And that's usually when an egg is released. And that's usually the prime time for getting pregnant. So ovulation becomes a little irregular during this time. And then of course the hormones are also kind of rising and falling during this time. I mean, some months they might be great, other months they might be really low. So some of the symptoms that women are experiencing, I would say the most common would be there's a change in their menstrual period. It's different. There's a change in their menstrual cycle. So instead of, if you used to have a period every 28 days, it might be every 24, 25 days. It might be a little bit longer. It might be maybe every 30 days. Sometimes there's skipping of periods. That usually tends to be more as women get closer to menopause, when the periods eventually will stop. Women start skipping like maybe several months in a row, or maybe they're getting a period twice a year. And so that would be one of the changes. Another symptom would be heavier bleeding, or just bleeding changes. I would say the heavier bleeding tends to be more common than the lighter bleeding, although I do know a fair amount of women in their perimenopausal years that have lighter periods, but it's usually heavier period. Because of hormone changes, usually a lot more estrogen, not as much progesterone. So maybe your periods used to be 4 or 5 days, maybe now they're more 7 to 10 days, sometimes maybe 2 weeks. Excessive bleeding, of course, you want to get that checked out right away, because that could be something else more serious. But usually you might have a few more days during your period that are heavier than it used to be. Another common symptom would be PMS symptoms are heightened or a little bit worse. PMS would be premenstrual syndrome, or just simply premenstrual. A lot of women do get signs and symptoms that they are getting their period. A lot of women typically know it's coming. It's about to arrive. Maybe a little bit of uterine cramping, maybe changes in energy, maybe a little back pain would be another symptom. But the PMS symptoms sometimes tend to be a little bit worse. Women might be getting headaches right before their period, or maybe a few days before. Women might be a little bit more irritable or snappy or impatient or more sensitive, maybe just a little bit more tearful right before your period, crying more easily. And that is definitely worse than what it used to be for when you were in your 30s or 40s, 30s and 20s. And then another symptom would be, for a lot of women, they start noticing that their moods are changing during the perimenopausal years. So some women might be feeling a little bit more anxious, like they're all of a sudden they have this anxiety that they didn't used to have, and that could be right before the period, but it could be all month long, where things that used to be a little bit easier for them to adapt to or take on, things are starting to cause a little bit more anxiety for them. Depression would be another one, feeling just a little bit more down, and you're not quite sure why. Your life is good, life is going well, job is good, kids are good, partner is good, home life is good, but for some reason you're just feeling a little bit more depressed and you're not sure why. Apathy would be another one, where women feel just a little bit more apathetic, like you feel like you don't care as much as you used to. You don't have quite the passion and drive and care for things that you used to enjoy. Like you don't enjoy the things that you used to as often anymore. And then another thing would be adaptation to stress. Just things tend to overwhelm women a little bit more during the perimenopausal years. Just you might be able to take on a lot. In the past, you used to be able to carry a heavier load and juggle a lot of things in your life and multitask, and now all of a sudden things are just really, really overwhelming, and you can't roll with the punches, so to speak. Like you can't take on the stress as well, and it's starting to really affect you physically and emotionally as well. Another common symptom would be sleep changes. That's probably a pretty big common one, is women start noticing that they go to sleep usually fine. That usually is not the issue unless there's something stressful going on in your life. But then women wake up. They wake up in the middle of the night. They're waking up at 2, 3, 4 in the morning, having trouble going back to sleep. And that's upsetting their day, because maybe now they're exhausted during the day. Some women can't go back to sleep. They wake up at 3, 4 in the morning, and now they're wide awake, and they can't go back to sleep because they have to get up at 5 or 6, and then their whole day is just kind of thrown out of whack because they are now exhausted and they're irritable and they're feeling sleep deprived. So that's another common one. That's also related to hormone changes. Some women are getting increased heat in the middle of the night. That one tends to be a little bit more kind of the later perimenopausal years approaching menopause, but maybe night sweats, maybe just feeling more warm at night. There might be the beginning stages of some hot flashes where you have to kick off the blankets, feeling intolerant to heat outside, especially in the extreme summer temperatures where it just gets to be really, really hot. So feeling intolerant to heat, feeling just more warm in general, and craving cooler climates and air-conditioned buildings and air-conditioned cars. And so that's another one. And then another one would be increased weight gain. This is probably probably one of the more common symptoms that I hear is all of a sudden now women are noticing a little bit more belly fat and weight gain, and their muscle strength isn't quite as strong as it used to be. Of course, you have to exercise and do muscle strengthening exercises to get the muscle mass, but body fat percentage goes up, muscle mass and muscle strength starts to go down. And then with the hormones changing or starting to drop during the perimenopausal years, is it changes the metabolism. So it changes how quickly you can burn through fat, and it changes how well you hold on to that muscle mass. There are ways around that. There are ways to adjust to this phase, and we'll talk about that in the third video. And of course, we could talk one-on-one about that if you come to see me as a patient. But it's usually the hormone changes, they're dropping, and then that changes the metabolism, and it also changes the size and shape of the body as well, which is, nobody wants to gain weight unnecessarily if they don't have to. So that's a big source of frustration for a lot of women. Another one would be sugar craving. Women are especially if you're not sleeping well, and your hormones are starting to drop a little bit. So women start craving more carbohydrates, refined carbohydrates, which would be sugar, maybe more breads, more pastries, more the unhealthy carbohydrates. Carbohydrates are also found in fruits and vegetables. Those are usually the good carbohydrates, but just more the unhealthy, starchy, refined carbohydrates that maybe aren't that great for you, which then leads to more weight gain. So those cravings are pretty common. Low libido, low sex drive. So maybe your libido used to be fantastic, and now it's just starting to drop a little bit, it's starting to be sometimes non-existent. I always ask patients, how's your libido? How's your sex drive? Is it good? Is it moderate? Is it low? Or is it non-existent? And several of my patients might say, oh, it's non-existent. So, and that's usually related to testosterone starting to drop. Of course, libido has a lot to do with your life, your partner, your kids, your job, your stress, how you feel about your body. There's lots of different factors involved in libido, especially for women more so compared to men. So some of the other changes would be like skin changes. Skin starts to become a little bit more dry, less estrogen, less collagen, less elastin. Estrogen is great for making our skin look wonderful and youthful. So skin starts to become a little more dry. Little bit more wrinkles, smile lines. For some women, they might notice a surge in acne breakouts. Hormone changes tend to lead to more like breakouts that maybe you haven't had in a while. That's also diet. That's also maybe certain food sensitivities, gut health too. We could talk about that if you come to see me. And then maybe some women are getting a little bit more facial hair, peach fuzz, chin hair, cheek, peach fuzz, random lip, chin hair that maybe you didn't used to have before that just appears out of nowhere. So that's usually related to hormone changes as well. So that's it for today. Those are the most common symptoms that I hear from my patients, and I've been doing this for so many years now that I've heard pretty much everything. The second video, as I mentioned, we'll talk about testing options for figuring out what's going on with the body. How close is she to menopause? Usually I can decipher that through symptoms, but a lot of times the testing will give me even more and give the patient even more information about what's going on. Third video, as I mentioned, will be on treatment options. So if you are interested in scheduling an appointment with me to talk about your hormones and get everything evaluated, or you just want to ask some questions first before you schedule that new patient appointment, you can schedule a 15-minute free discovery call that I offer to all patients, and that is complimentary. You get to ask questions about what you're going through, what to expect. Just visit my website at drkristi.com, DOCTORKRISTI. Click on schedule an appointment, and you can schedule that 15-minute discovery call. So thanks for tuning in today, and I will see you next video. Bye.